Several things can increase your risk of a fall, including illness, a change in medicine, or an unsafe or unfamiliar setting. Health conditions affecting eyesight, hearing, muscle strength, or balance increase risk of falling. Certain medicines can increase fall risk, including medicines used for sleeping problems, anxiety, depression, and medicines to control pain. There are things you can do to prevent falls. Keep adequate lighting. Keep your home well lit so that you can easily see where you are going. Keep pathways clear, especially when using assistive device. Remove throw rugs, secure electrical cords, and remove clutter. Keep phone close to you and consider getting an alert system with automatic fall detection that informs a medical team when needed. Install grab bars in bathroom. Use durable medical equipment when needed, such as a shower chair or tub bench. Group commonly used items together. Place items within reach or at waist level to minimize bending and reaching. Sit when possible for prolonged activities like when preparing food or chopping vegetables to cook or in gardening. Pace yourself and your activities. Plan ahead and divide tasks. Rest or take breaks in between tasks. If you have unsteady gait, slow down with turns. Maintain a wide base of support when you need to stand for some time. Keep your feet at shoulder width apart for improved stability. Don't carry too much. Avoid alcoholic beverages and get your eyes checked once a year. Use eyeglasses when needed. Do balance exercises and if needed, ask your doctor for physical therapy or occupational therapy. If you like this video, please click the like button, hit subscribe, and ring the bell. Be healthier!